And over 150 unvaccinated students are quarantining in South Carolina after measles exposures. They're from two schools in Spartanburg County, where an outbreak has grown to at least 8 cases. Dr. Sutton, these 153 students now have to quarantine for 21 days. How does that work, and what happens if more of them test positive?
Yeah, well, during this period, children have to quarantine who are unvaccinated. So important to understand here, this quarantine is very much preventable, as children who are vaccinated can stay in school and stay protected. So what happens at home? Parents must watch for symptoms of fever, rash, and other signs and symptoms of measles. And if that child is cleared at the end of 21 days, they're often cleared by public health officials and then allowed to go back to school. But Diane, there's an important part here. Testing resumes. If a child is found positive, then that isolation period begins, and then contact tracing around that child begins, and it may lead to additional quarantines. We don't yet know. It's a symbol of what's going on across the country, not just in South Carolina, but also in states like Minnesota. For example, we're seeing these quarantines take place, again, because there are children who are unvaccinated. We've seen a steady decline in vaccinations since the pandemic, and unfortunately a rise in outbreaks.
The CDC says measles cases are the highest they've been since 1992. So how are they trying to turn that around?
Yeah, with education, a lot of the confusion comes to parents through the voices, through opinions, through a lack of scientific data. But what's important to understand is that the science has not changed. MMR vaccines still remain highly effective and safe, up to 97% effectiveness. And again, these quarantines, these outbreaks are completely preventable. This year, we've seen at least 44 outbreaks. That is significantly up to the around 15 outbreaks last year. And that's not just in the United States. We're seeing this globally. There's vaccine misinformation. There's a lack in the ability to access to vaccines itself in other low-income countries. And because of that, we're seeing a rise in the rate of measles and other preventable infections.